This is disturbing, it's surreal, it's dangerous, and it's wrong. My name is Esther Chu. I am an emergency medicine physician and a health services researcher. What I find troubling about this administration is how it is actively dismantling our process of scientific inquiry and progress at every level. They are interrupting the usual flow of scientific proposals through review and on to funding. They are cutting off funding on existing projects, even those that have tremendous promise. They are reducing the staff that runs the machinery of our federal funding agencies. They are defunding the research that examines the quality and safety of the healthcare that we provide. They are sending institutions of research, our universities across the country, into chaos and uncertainty by disrupting the traditional contract between the government and universities that has allowed research to move forward steadily and consistently. None of this is a retooling for efficiency. These are deep, fatal cuts to multiple lines of critical research. What is disturbing about it is what this means for the health of our nation and our ability to contribute as a global leader in biomedical science. It is disturbing because of the careers and the expertise that we are simply hemorrhaging. It is disturbing for the effect on the next generation of American scientists that will grow up in an environment that has been depleted. This is disturbing, it's surreal, it's dangerous, and it's wrong.
My name is Paul Offit. I work at the Vaccine Education Center at the Children's Hospital of Philadelphia. What I guess has impressed me most about the last 100 days is that we are in the midst of a huge measles epidemic. Although the CDC currently states that we have between 900 and 1,000 cases, people on the ground have told me that's a vast underestimate. It's probably closer to at least 3,000 cases and probably 5,000 cases. We've already had 3 deaths from measles in this country this year, which equals the total number of measles deaths in the United States over the last 25 years. We just had the first child death. 2 little girls who were previously healthy have now died of measles, even though we hadn't seen a child die from measles in this country since 2003, more than 20 years ago. And I just think we need to make it very clear in a full-throated, unabashed way that children need to get an MMR vaccine, a measles-containing vaccine, because this can save your life.
It's Atul Gawande. I led global health at USAID, and the development I want to highlight is the dismantling of USAID. This independent agency today has been reduced to what will be just 15 staff, down from 13,000 by mid-September. 86% of its programs have been terminated, and those that remain have been kneecapped. Why does this matter? Because we will have lost protection from deadly diseases from abroad, because we will have seen hundreds of millions of people who are now at risk of greater disease and death, with estimates that 500,000 people or more will die as a consequence.
Hi, I'm Larry Gostin. I'm professor at Georgetown University. The most monumental thing in Trump's first 100 days happened on day 1 when he withdrew from the World Health Organization. He instructed the CDC to call back all of its overseas personnel, and he asked CDC not to even communicate with the World Health Organization. This is important because it's historic. The United States was the key inspiration behind the World Health Organization and will be the only country on the outside looking in. I can't think of a single way this advances American national interests or keeps the world healthier and safer and more secure.